school, right? So you do have school.
Hi, Teresa. My name is Lee. I'm going to be your student physical therapy assistant today. Your name is Teresa, correct? Okay. So I see that you have spondylitis in the lumbar spine. So that means that the discs are getting closer and closer because the disc in between is getting smaller due to age and all that kinds of stuff. As we get older, it gets smaller. So we're going to try to work on a program that will hopefully open up the space so that there's more space for the nerve to come out so there's not pressure against the nerve. Does that make sense a little bit? Yeah. So what I'm going to have you do is, I have to look at my list because I don't even have it memorized. How is your pain right now?
6 out of 10.
6 out of 10. Now, is there a position or things that you do during the day that make it feel better?
Sitting.
Sitting, okay. And anything that makes it feel worse?
Reaching up.
Reaching up, okay. So obviously, the things that make it hurt, no do. And if you try, you can't sit all day, but we're going to work on some things today that will hopefully put you in a better position so you can do your day-to-day activities.
Okay.
Are you ready to get started? So the first thing I'm going to do is, first of all, it's all right if I put my hands on you and touch you and do some therapy with you.
Okay.
Perfect. Let me have you lay down on your back. We'll just use one pillow, just for the time being. And we are going to start what's called a flexion program. I'm going to have you keep your knees bent. It's probably going to take a little pressure off your low back. So when I do this, I want to put you in what we call a pelvic neutral or a slightly posterior tilt. I want you to take some of the arch out of your back because that's causing some of the problem.
Okay.
Does that make sense?
Yes.
All right, so I'm going to put my hands on your hip. And I'm going to teach you how to get into a pelvic neutral position. I'm going to put my hands here. What I want you to think about is rolling your bottom off the mat, and that's a posterior tilt.
Okay.
And then I'm going to have you rock the other way, and this is an anterior tilt. So we're going to do this a couple of times, just so you get a good feel for it. Now, when you feel like you're in the middle, just kind of tell me, and that will kind of, okay. So that's good. We call that pelvic neutral. So now that I have pelvic neutral, I want you to think about pulling your belly button to the mat. But you got to keep breathing. You can't hold your breath. You might pass out on me. Can't have that happen, right? All right. Can you do that for me? Good. And are you breathing? Yes, Lee, I'm breathing. I'm just talking to my patient. I'm making jokes. Distract them a little bit. And relax. So when you do that, make sure that we don't change our pelvis. That's the big thing. Show me that pelvic neutral again. Can you get into that position? Find that. If you have to rock back and forth a couple times, you can. Is that all right? Pull the belly button down. Okay. This time, now I just want you to relax. So we found pelvic neutral. I can have you do that. You can do that on your own, right?
Okay.
The next thing is I want you to take this knee and pull it up to your chest, and we're going to stretch your gluteus maximus, or your bottom muscles.
Okay.
How long do you think we should hold this if we're going to do a stretch? You are a good patient to know that. We're going to hold for 30 seconds. We're going to do it 3 times on this side for 30 seconds, 3 times on this side for 30 seconds. I'm not going to have you do all 6 sets. You'll do 1. Okay? And I'm going to have you relax. The next one is we're going to do both knees. Now it's a little bit more aggressive stretch. You might not think so, but technically it is. So I'm going to have you pull both knees up and give yourself a hug. How long do we do this again? I forget.
30 seconds.
30 seconds. So, Teresa, this is a great exercise at home, stretch for you to do at home. You can do it in your bed before you get out of bed. You can do it before you go to sleep at night, but it's a good stretch to do. Okay? That's 28, 29, 30, and relax. So the next thing is, the first 2 things, first one was pelvic neutral, second is 2 stretches. The third thing we're going to do is a crunch. And you're going, oh no, I got to do crunches? Yeah, but we're just going to start easy. I'm going to have you put your hands on your thighs. With your fingertips, I want you to reach towards your knees and try not to throw your head around. Just try to go up as far as you can comfortably and then come down nice and slow. Let's just do 1 and see how you do. Perfect. Let's just do 4 more and see how you tolerate it. Good. Excellent. I like it. All right. So, just to let you know, today's our first day, so we're just kind of testing you out to see where you can go.
Okay.
The next one is we're going to do oblique crunches. It's kind of the same thing, but I'm going to have you cross your hands over one over the other, put them up in the air, and I just want you to reach your fingers towards my hand and then back down and rest. Okay? And we're going to do the same thing on this side and reach over. Same thing. The goal is for us to do 3 sets of 25 normal crunches, 3 sets of 25 on each side. Then we can move on to the next program, which is called the static lumbar stabilization program, which we're going to start now. Okay? There you go. Pretty straightforward. All right. So now we're going to do the static lumbar stabilization program. And we are already in the right position.
Okay.
What we're going to do, the first thing is find our pelvic neutral. Can you do that for me? Excellent. Okay, the next exercise, I'm going to slide this pillow out just a little bit. If you want it, we can use it. If you don't want it, we can take it away.
Yeah, I don't want it.
Okay, perfect. Some patients do, some patients don't. Maybe start with one hand, your hands down here. I'm going to lift this arm up just to 90 degrees. And this, and then we're going to lower it down. I need to say something first. This is called the static lumbar stabilization program. That means our trunk is not moving. But we're going to do some things with our arms and legs to increase the intensity, the better our trunk stays static.
Okay.
All right? So it's not about how much we move our arms, it's how we move our arms and our trunk stays in place.
Okay.
All right? So we're going to start with your arm up. And then as you hold your static, your pelvic neutral, I want you to let this arm drop and raise the other arm up. And we're just going to alternate our arms and back and forth. Let's just do 3 on each side just to practice. And if that's too easy, you can lift your arms a little bit higher and then back. That will increase the intensity. Might not be a lot, but it's enough. And then hands by your side. The next one is we're going to do marching. So all I want you to do with the marching, what is this all about? I forget? Static. It's all about the trunk, right? We're going to make sure that trunk stays still and we keep that pelvic neutral. With the left foot, I want you to just lift up 1 or 2 inches and back down. And up and down. Can you do that all by yourself? You can even not even go that high. You are being an overachiever patient. I like it. All right, and rest. So the other exercises that I'm going to have you progress down the road is we're going to do arms and legs together. We call that dead bug. And eventually we're going to do bridges.
Okay.
So I would take her through, at that point I'm going to say, if you know alternating arms, you know alternating legs, I'm going to say, what are the next exercises? And you're going to go, they're this, they're this, they're this. Okay, let's move on. So next exercise, I'm going to have you go ahead and sit up on the edge. So we've done everything so far in supine or on your back. We're going to move to now putting you on your stomach, which it might be a little more difficult, but I think you'll be fine. And we've already accomplished all the exercises that we're going to do on our back. So we got to move on. We're progressing. We're doing good. So what I want you to do, Teresa, is I want you to go ahead and get up on your knees, up on the mat, and face the pillow. And basically, I want you to put this pillow on your tummy. It should be on your tummy when you lay down on the mat. Okay? So we've been working everything we're still working on that static lumbar stabilization program. So we want to get you into a little bit of a flexion. But now we're going to start doing the arm exercises that we did when we were on our back. But we cannot go into arch. That's why we're sitting laying on the pillow. So I'll just want you to do it like you're a swimmer. And I just want you to lift up one arm and then the other. Just back and forth without changing anything here. And back and forth, and just do a few. Excellent. And rest. Okay, how do you feel?
Okay.
Guess what we're going to do next? Oh, we're going to do the legs. You're so smart. All right, so we're going to start. We're going to do little swimmers. What are we going to try with the back?
Not to arch.
Not to arch. All right, here we go. 1. There we go. You can go slower if you want. Perfect. And rest. Then we can do arms and legs. Then we can move on, and then we're through with this program. Thank you. You can sit up. Perfecto. So I've introduced myself. I've done a flexion program. I've done the static lumbar stabilization program. Go ahead and sit at the edge. Now I'm going to do a stretch. Let's see. I did levator's stretch. I'll do the scaling stretch. That's yours. Just so you know. I'm going to have you sit on the edge of the mat over here. And we're going to say that it's your right scalings that are tight. Right scalings, brachial plexus, which has all these nerves, and there's some blood supply that run down to the arm on both sides. It's tight, so we're going to try to stretch those muscles out so that you might not have some tingling down your hands. So what I want you to do is, I want you to think about putting your left ear towards your left shoulder. We call that contralateral side bending. So go ahead. Then I want you to, we're going to stretch the posterior fibers of the scalene. So I want you to turn ipsilaterally or turn to the right because it's your right scalene. I'm going to hold your head so it doesn't move, and I'm going to gently push down on your shoulder. When you feel there's a stretch of about a 5 out of 10, you let me know. Anything?
Yeah.
Okay, we're going to hold for 30 seconds. How are you feeling today?
Good.
How was your train ride up to school today?
Pretty boring.
Oh, yeah, I bet. Are there any weirdos on the train?
All the time.
Oh. So I'm just talking to my patient. So 20, that's about 20 seconds. So are you going to Disneyland tonight when you get home since you live right across the street from Disneyland?
No.
And then I'm going to take my stretch off slowly. So that was a posterior fibers. I'm going to do the anterior fibers. So I'm going to do contralateral side bend again. I'm going to do contralateral rotation away from, and then I'm going to have to do flexion at the same time. I'm going to do the same stretch. I'll support with my left hand. I'm going to push down on the shoulder. You tell me when it's about a 5 out of 10 on the stretch.
Okay.
Is that it?
Yep.
All right. We're going to hold for 30 seconds. So, do you go out and watch the fireworks every night when Disney fires the fireworks?
I do.
Oh.
Oh yeah, you can see it every night.
I
huh?
can see them every night. You're
I
right.
know. It's kind of crazy.
privilege.
They're in my backyard.
In her backyard.
That's awesome.
So,
He doesn't
No,
like
the fireworks is
Disneyland.
actually one of the coolest things in this place.
and then I'm going to pull the stretch out slowly. And there we go. So there you go. I'm going to teach her how to do it by herself. So now, Teresa, I'm going to show you how to do this stretch at home since I can't be there. It's not going to be as effective as I'm doing it, but it's still effective.
Okay.
So what I would like you to do is we're going to do the posterior fibers first. So if you remember, I had you bend your head to the side and you look towards your shoulder with this left hand. You support. Now you can put this hand behind you like you're trying to scratch your back and try to push your shoulder down on its own, or bring this hand up and scoot closer to the edge of the mat. And with your right hand, try to pull your shoulder down with your arm. But don't let this head slide up. Can you feel a stretch in here?
Yeah.
All right, so how long would you hold this?
30 seconds.
30 seconds. And then come off. And now we're going to do the anterior fibers. So you're going to contralateral side bend. You're going to look down towards your left armpit and head down. And now pull down with this shoulder, and you should feel it more on the anterior aspect.
Mm-hmm.
That's anterior. Okay? You'll feel it when you do it. And then take the stretch off, and you are done. Any questions before I let you go? All right, Teresa, it's nice seeing you today. We'll see you next time.
All right, see you, Lee.
All right. Yeah, and I did time it today.
Those both for scalings.
Those are both for scans. I did the anterior and I did the posterior. You're going to hit the middle doing both. All right. So, Priscilla, you have a question? Okay.
How many times did you do the...
Depends on how well in the clinical setting, depends on what my patient can tolerate. Can they maintain trunk stability while they're doing it? I want to get to 25 to 30 reps of 3 sets. It's kind of my goal before I move them on. Can I move them on if they can do 15 or 20? Sure, but I really want to make sure that they have good endurance during the static lumbar stabilization program. But if they, after 2 or 3, they lose their pelvic neutral, I have to stop them there, either regress them just a little bit so that I know that they can do it properly. It's all about the trunk, right? All right. Any other questions? Okay. So just to let you know, I just did the flexion program. Oh, I don't have the sheet. Everyone, who has their Bible? The Bible. Oh, here's your Bible. So in the Bible, remember you're only for the lab practical, you just need to know the first 1, 2, 3 boxes. And then on the flexion program, you need to know 1, 2, 3. You just know that when I get to the end of bilateral arm and leg lift for the extension program, that's your cue that you can start the quadruped. Same thing on the other side. Okay? Chris?
Yeah, we're not putting them in the quadrupeds, but you might ask like what it is and what the purpose is.
No, I probably won't ask you that. So I just want you to know that, just FYI, in the clinic, they'll say, why are you going to do the quadruped? What? It's still trunk, but think about it, it's mostly working rotators and multifidi. Because it's, as you lift up one arm, you want to roll, those rotators and multifidi have to hold you static. So just keep that in mind, all right? So what I'd like you to do is, I'm giving you plenty of time. There should be no excuse next week when I say, do flexion or extension. You should go, piece of cake. Here we go. You have 2+ hours here in the, you'll probably finish and you'll be bored, but keep going. And I will probably let you out early, but don't waste your lab time. You have me here to make sure you're doing it right. Because you're going to say, well, I'll just do it over the weekend with Priscilla. Well, all of a sudden, what did Lee do? Oh, man, I forget. So you got me here, might as well use me. All right? So, do both the flexion program, do the extension program, and do the stretches of the upper trap, scalenes, and levator scap manually and self-stretch for home exercise. Okay?
So in the beginning, was her spondylosis?
I did spondylosis.
Yeah.
But when we do the cervical spine, it doesn't matter. I'm giving you a stretch.
We have to know so we can describe. Are we gonna
For that, if I said, oh, you pull spondylosis, and you go, oh, spondylosis is
What else is there gonna
any of the spondylolisthesis,
be? All of those.
yes. And then on the extension side, it'll say disc herniation. It will say excessive posterior tilt. I have an excessive posterior tilt. So something of that nature, I have to try to make the numbers a little bit even, so I'll probably put disc herniation, posterior pelvic tilt, spondylolisthesis, spondylitis, and so that's your even numbers. So and then I'm going to mix them up so you don't. So you have a 50-50 chance of getting one or the other. All right? Any other questions? So I'm just going to tell you, when I do the lab practical, I'm going to be back here with my victims. Okay?
Actually, I do have a question.
Okay?
Should I call Ariel and ask him if you have a question?
Yeah, where's Ariel? I thought he was going to be here at lab this morning.
No, you have
Because
maybe give us the
I
area.
don't know. The more I kind of try to learn this, the more I'm getting confused.
Lee, can you,
Okay? I'm going to answer her question, Phil, and then I'll answer yours.
Can you maybe show what the patient would look like if he had a herniated disc? What would he walk in? How would he look? Or what would be his more likely position?
Sure. The position would be,
That would be
you don't like flexion at all, right?
Flexion's not, it depends if it's prolonged, and I can go into extension, but if it's hyperextension, that hurts too. So it's kind of
Okay.
in the middle.
That's why we got to find pelvic neutral or slight bias. So, in my example this morning, that Becky was my guinea pig. She was the patient. She goes, I don't like to slouch. It's sitting too long. She used that example. And she goes, I don't mind walking as long as I'm walking slowly. So a lot of fast movements they're probably not going to like, but they're going to prefer trying to get into a little bit of extension because that's going to hopefully centralize the back. Most likely they're going to have, with most of these patients, lots of quick movements or movement where there's a lot of movement in the lumbar spine. It's going to cause pain. That's why we're trying to get the static, get the static part taken care of. Does that help? Also, Margarita, I think maybe if I answer some specific questions more one-on-one on the side that might help.
Yeah, I think so. Yeah.
And then I can, and then I'm gonna be walking around, I can answer any of those other questions. So I'm gonna go to Phil next.
Could you just demonstrate real quick the elevator scapular stretch?
Sure.
again?
Yes. So I'm gonna, let's say, we'll do the left since I just did her right. So levator, remember it's on the back, it's on the posterior aspect. It goes from the superior angle to the transverse processes of 2, 3, 4, or 1, 2, 3, something like that.
1, 2, 3, 4.
So I'll just ask the masters over here who know. I'm gonna have her put her arm behind her head because levator scap does elevation, but it also does downward rotation. So I'm gonna upwardly rotate. I'm gonna slide my hand. She's more flexible than most. I'm just relaxed. I'm going to have her go into side contralateral side bending and forward head flexion. And I can already feel it. And then I'm going to stabilize with my hand on her head, use my forearm to depress the scapula. Do you feel a stretch yet?
Mm-hmm.
And then I'm going to hold. So I'm trying not to let the head pop back up. And I want to depress because it does elevation, and I'm going to upwardly rotate because it does downward rotation. And then the self stretch is, uh-oh. And, the hand goes on the head. Pull the head down into contralateral side bending and flexion, and then you're trying to lift this arm up. You feel a stretch?
Mm-hmm.
Okay. So it's not as effective as doing a manual stretch, but they're still getting a good stretch. Okay, so you're just trying to reach down the middle of your back. Perfect. And then you can come off easy. Perfect. And then upper trap is pure side bending with holding the head and pushing, because upper traps do upward rotation and elevation. So I'm going to push down on the chromium. I'm going to depress on the chromium to depress the scapula and downwardly rotate the scapula. Okay? And then the same thing, I can use her, she can use the edge on the home exercise, move up to the edge a little bit more, side bend, and then use the edge of the mat to press your shoulder. There you go. You feel a nice stretch right up there.
It's ipsilateral side bending, that's true side bending, or?
This is contralateral side, true side bending. So there's no rotation or flexion extension component
Oh, I see that.
for the upper traps. All right, any other questions? All right, got mats. I would say in the clinic you want to use more of a mat like this, because those mats are really soft. You can't see if they're in a posterior or anterior tilt.